you?
I'm good, thank you. Nice to see you again.
Yeah, nice to see you. You're looking good.
Oh, thank you.
I found out about this
bigger.
program through telehealth. In my first trimester, I was actually losing weight due to the vomiting and nausea that I was suffering. And the nurse that I spoke to actually gave me the contact to call. And so the program is called Healthiest Babies Possible. And it really helped me learn about what type of food I'm supposed to be eating to avoid these nauseating spells.
As much as you could. Seen your doctor lately?
Yes, I have an appointment this week.
When you are pregnant, your body is another one. It's very different, and you need to adjust your foods and adjust the way you regularly eat. Sometimes your mother says one thing and your friend says another thing, and you have a lot of information, and you need to get expert advice from someone who really knows about it.
And really, there's not a brand that is better than the other ones. Are mostly
The Healthiest Babies Possible program is a free, client-centered, culturally competent nutrition support program for nutritionally at-risk pregnant women. They live in the city of Toronto, they're less than 28 weeks pregnant, and are at risk of having a low birth weight baby, meaning that they are going to benefit from the expertise of having a registered dietitian. Our goal is to contribute to healthy birth outcomes among the nutritionally at-risk pregnant women living in Toronto.
The 1 hour visit every 3 weeks was a kind of motivation for me. Like I had somebody who would check on me, like she had a checklist. And it was very nice that you had someone to talk to. And she knew that I was concerned that my elder one was low birth weight. So I wanted to make sure it wouldn't happen again.
A low birth weight baby is a baby who is born weighing less than 2,500 grams or 5.5 pounds. And low birth weight babies are at a significantly higher risk. Some children could die within their first year, and they may not notice some of the impacts of having a low birth weight baby until their children are getting older and you're seeing them not meeting some of their developmental milestones, or when they're entering school and having some learning disability issues.
Okay, I can use this one. That one looks better.
What we try to do is find out already what they are eating so that we have an idea of what kinds of changes they might need to make, what kind of improvements they can make in their diet. Very often some of the things that they're not having is because they can't afford them. So that's where we have the ability to assist them with the food certificates. There's no point in telling somebody that you should go out and have milk, or you should be having more meat or something like that when those items are expensive and they can't afford them.
Because that's what we want. We're getting to the target that we need you to get to between 25 to 30.
It really helped that Lori would provide me with food vouchers for the grocery store. And sometimes she'd give me between $40 and $50. And that always helped because certain foods that I couldn't necessarily afford or that I was craving for, I was able to purchase. I would definitely say that that was something that I really appreciated.
That's where you get the calcium from.
Laurie used to give me advices on how I could increase my calorie intake. With the items I already eat, she used to tell me to add extra stuff into it so that it would be more nutritious. So I used to like eating popcorn, so she used to tell me add more butter into it. Then she had even told me when I have my milkshake to add a little more of extra milk powder into it so that it would be more intake of calories. So yeah, these are a few wonderful things that she had told me about, and I had started doing that.
It's a big system now.
The playbook is they're supposed to use the nutrition expertise, how to take sort of the science of nutrition and the science of the pregnancy and make it so the clients can leave the visit with the dietitian and know exactly what foods to purchase and what foods at lower cost that they can purchase and where they can easily access those foods to support them in having a healthy pregnancy.
Right now, basically that energy that to replenish what you lost.
Being part of this program actually helped me gain the target weight that we were looking to gain. I also felt healthier whenever I, felt like I was low energy. I knew exactly what I needed to eat. If I had any questions about social services or anything that I needed in order to get connected with other programs in the city, she was always more than willing to help. And yeah, just having someone to talk to was really nice sometimes.
This pregnancy, I would say I gained more weight than I did for my second pregnancy. With my daughter, I didn't gain much, as I'm supposed to be gaining, but still I had a nice healthy baby. With my third pregnancy, yeah, I did gain more, and I think that made the difference in having slightly bigger baby than my daughter.
Well done. Give mama a high five. Give mama a high five.